Well, hello there. You're watching OffBeat Business TV or listening to the OBBM Network podcast. My name is Susan Hamilton, and I'm here with Lauren Davis, Richard Fleming, and Maria Leon. And we've got some really interesting stuff to talk to you about Dallas County. Actually, the whole DFW, actually American information that's going to be really great for your business. Why do you need to know about this stuff? Hey, you're going to have to listen in. We'll be right back.
Welcome to OffBeat Business TV and the OBBM Network podcast. CEO and host Susan Hamilton shares vital insight from local DFW leaders on successful life and business, focused squarely on local family business. It's time for our nation to rise, and we'll do it through a vibrant local business sector that stands up for life, liberty, and the pursuit of happiness. Ready to meet your advocates? Here's your host.
I'm so excited to share this episode with you today. I've got Lauren Davis, Richard Fleming, and Maria Leon, and we are going to be talking about some of the things going on in Dallas County. First and foremost, I want to congratulate you on your recent primary win for Dallas County Judge. I think it's interesting, and we always want to go back to, okay, what is a Dallas County judge? Because so often we don't understand that. So help us understand a little bit about this, because evidently you're in charge of emergency management for Dallas County.
Yes, that and among many, many other things. So it's essentially just the CEO of Dallas County, or you can call it the mayor of Dallas County, or a chairman or chairwoman. It's an administrative position. County government's meant to be the administrative arm of state government. It's never meant to be in conflict with it, and that's what we've seen in our current situation with the emergency management. He went direct conflict with our governor, which should never be allowed. And so it's just overseeing elections, health and human services, and the elections are a big one, IT, human resources, the sheriff's department, which includes our jails. So there's a lot of things that are going wrong because of a lack of leadership, and the number one thing we need to do is educate ourselves about the position, so then therefore we can pick the best leader we want for that position. And I don't think that Dallas County has had that opportunity in the last couple of years, and I think that has shown itself through the pandemic.
I'm in so much agreement, and I think you would agree with me that we've just seen so much. It seems like a club, a group of people that have decided that they are going to make these decisions that seem so out of touch with the people that you run into every day.
Well, and most importantly, they were dealing with medical health decisions that, you know, they're not physicians, they're not qualified to make those determinations, and they're not scientists. So there were a lot of decisions that were made about what people should and shouldn't be doing health-wise during this pandemic of 2019 to the current day that really kind of took power away from people and took power away from physicians and patients in general on the decisions that they wanted to make. And
You know, Dr. Fleming, if you would just describe a little bit about your amazing ability to speak on behalf of this. I mean, I don't know, you've come from you put a lot of effort into your education so that you can speak to things with authority. Help our audience understand a little of your background.
Well, I'm originally a physicist, so I have a PhD in physics, and I'm a medical physician as well. So I'm a nuclear cardiologist, which is a cardiologist dumb enough to take more training, and I'm also an attorney, a JD. So I've incorporated all of those into my understanding about this virus, which is SARS-CoV-2, and the disease that occurs from it called COVID-19. And looked at it, did research looking at the treatments, research looking at the infection, some research looking at the vaccines and the consequences. And when 2020 began, I simply sat down as a scientist physician and looked at what we did know about treating viruses, what information had been accumulated beforehand. We knew right up front from 2007 from a National Science Foundation study that the number one thing to do was to shut down international travel. There wasn't anything in that said that we need to shut down businesses. We know confirmatory now from the Johns Hopkins study that was recently published that 90% of the benefit that occurred for people occurred from individuals who were ill, distancing themselves from people that were not, and from better hand washing. None of that showed a benefit for masking across the board. Masks are useful in the right environment, unless you're practicing surgery. You know, I use them. surgically.
Well, ever since I started listening to you, I've always thought it was interesting that you took one look at all of this and your attorney hat came on. And you started going, wait a minute, I can see that legally we have some issues here. And I appreciate you speaking so boldly about that.
Well, we have major issues, and Lauren can help an awful lot with that, because we have some issues that we're presenting for the Republican platform that I'd like to see the Democratic platform get behind it. You know, they're elected officials for the people, and I think it's critical for everyone to understand that the United States Constitution, as we were talking about briefly before the program, is an agreement. It's a compact between the states of the United States of America, that's why it's called the United States of America, and the federal government. And the way that this works is the exact opposite that people seem to think that it works. Most people seem to think that the federal government tells the state governments what to do, and the state governments tell the people what to do, and that's exactly flipped on its ear.
Absolutely.
The way that this was put together by the founding fathers, they came together as the people and as the states to make an agreement with the federal government. Now, up front, they said the states would give certain powers to the federal government just so we could get rolling with the Revolutionary War, because Washington couldn't move troops the way that the Articles of Confederation had it set. And then they knew that they would have to come back and amend the Constitution to take powers back away from the federal government. But the way this works is that the people tell the states what to do, and the states tell the federal government what to do. You know, it's amazing. We pay taxes. The federal government doesn't pay in taxes. The people pay in taxes to the states and the federal government so the government can run. But we control that cash flow, and it's gotten to the place where the federal government thinks that they control the cash flow and tell us what to do with our money, tell us what to do with our health. The health care of the United States is the 10th Amendment to the U.S. Constitution says that anything not specifically included in the federal document called the United States Constitution is given, not given, it belongs expressly to the states. It doesn't say it belongs to the government unless we decide it belongs back to you. It says
consent of the governed?
Yeah,
Is that what that says?
Yeah, the consent of the governed,
Yeah.
right? And we've had this conversation before where we talk about the Declaration of Independence. That comes from, 2/3 of that comes from my family documents, Flemish documents, we the people. Okay, that was from the Flemings, from Belgium, and then the other third of it came from the British people, the 1600s. So it comes from the people to the states to the government, not vice versa. And,
so I'm appreciating you bringing it back.
Yeah.
Healthcare is controlled at the state level, and where the governors control the state medical boards, county judges, which is just, I mean, that term just smacks me in the face.
In name
wrong.
only.
In
right.
name only.
Right.
There's no,
In name
this is not
only.
a judge. So the first thing might be to change the name of the darn thing to what it actually is, but is to get out there and to work with the people on what is and is not appropriate. And you know, we've submitted things for resolutions for the parties to have, and I know that you have some very strong pieces of information I think that you've shared on what you think should and should not be done in the county level.
Right.
And I would argue that the people that usurp the power at the county level should eventually be held responsible for what they've done, which is to take power from the people that they didn't have the authority to take.
Right, and I think it's a really interesting manipulation of that conversation, because I experienced a huge fight in the ISDs, right, in Dallas ISD, along with now taking it county-wide. But there's this manipulation of the argument of local control, right? And
I've noticed that.
Right, and
I've
so now the
noticed that.
superintendents are like, oh, I have local control in this, and I'm going, the American, have local control over my body.
The one voted in also, right?
Right. My body, my children, my family, and nothing overshadows that and overpowers that. And all these little petty mini tyrants are coming out of the woodwork saying local control over the ISD. Sorry, buddy.
Right.
You know, Hinojosa, you don't get to mask up my children, especially with my son having a heart condition. I think the argument can be made. He survived 3 open heart surgeries. We reject fear. If we were, if we were fear-driven people, I would have never been able to parent him through those highly traumatic events in his life, and we'll parent him through future ones. And if we subscribe to fear, We can't do that. So we can't have our leaders of our medical communities or of our county or of our government piping in fear in an effort to control us.
Yeah, and
it's
those big
immoral.
question marks
And
are
that's-
also where that comes from, right? I mean,
Yeah.
when there's a lot of question marks, we wonder, should we be afraid, right? Because we don't have a definite...
Absence of information creates stories.
Information. And I think when we come back, we're going to go into all of that, because I want to dive into that absence of information. Of course, that's directly tied into our First Amendment. And we can start drawing some conclusions here. And we'll be right back with more from this.
My American dream is to help you stay healthy and energized so you can live your American dream.
Our American dream is equipping future generations of American dreamers.
My American dream is to protect my community so they can live their American dream.
My American dream is to bring you some spice and flavor to your life.
Our American dream is ensuring what's most valuable to you.
Our American dream is creating opportunities for healthcare providers so they can have their American dreams.
My American dream is serving our business community and advocating for all of your American dreams.
Interested in starting a podcast or TV show? Worried about what you'll say and how to keep it engaging? Think you'd like to be a guest on podcast, radio, or TV shows? Hi, I'm Susan Hamilton, owner and founder of OBBM Network, and I would like to invite you to an OBBM media training to get the tools you need for a relaxed and polished performance you'll be proud to share. Our specialized training techniques include role play, voice training, and everything you need to deliver a confident, clear, and engaging interaction. Go to offbeatbusiness.com. Go to the calendar and register for a training that's convenient for you. Dates available now, 214-714-0495. And we're back. This conversation is just getting hot. So you've seen a lot of this in your own life, and you realize that we had to start taking responsibility of our personal lives when it comes to everything about freedom says that we have to stand for that.
Freedom is the most basic human right. And when we lose that, it really becomes a dangerous world, and especially when we're talking about our medical community. And I know we were talking earlier, there is a fear now approaching the medical community and an erosion of this institution that's supposed to be there to help us live longer and get more out of our life now feels like it's there to control our lives. And I went to my first, appointment post-pandemic with my son for his annual checkup for his heart condition that he's had 3 surgeries for. And I had anxiety around going, are they going to require the vaccine in order for him to access health care? What's going to happen in that room? And the conversation got started, and I held my ground and I said, no, myocarditis is a real thing. My 14-year-old son has a repaired heart, and my individual logical brain says myocarditis is a bad idea for him.
Right. Well, it's a bad idea for everybody. And I mean, that was, speaking to part of my background history, that the theory that explained why viruses and other infections can cause this inflammation and blood clotting is the theory that I brought out at American Heart in 1994. So this is not a brand new concept. And what you're getting to on fear is the absence of what we want. Fear is what we saw an awful lot of. Informed consent means there is no fear. That's one of the things informed consent means. Informed consent means that we, the physicians or medical community, explain to you, and I would argue that informed consent...
I've signed a lot of those forms in my years with the kids.
We explain to you both sides of the equation.
Yes.
We have to explain to you, well, we don't have to, but we ethically need to explain to you what we think is going on, why we think it's a problem, and what the options are.
Yes.
Okay, those options mean that we're supposed to tell you any potential conflicts of interest that we might have, any potential conflicts of interest that Big Pharma might have, or the hospital might have, or the insurance company might have, and allow you to see what your outcomes should be. right? It allows you to make a decision. I don't make, as a physician or scientist, I don't make the decision for you. Now, I'm pretty good, I would like to think, somewhat adept at guiding you to make the right decision, because you didn't go, you weren't a medical student.
I didn't
right?
go to medical school.
Right.
I mean, you don't come to me for economic advice.
And
I mean,
a
that
lot
would
of
be
times,
the dumbest thing.
as a mother, we're in trauma when we're making
That's
decisions.
right.
I go
Wow,
back to
good
when
point, good
I go
point.
back to when I had to make these decisions. I had a 15-month-old boy at home. My son was born unknowingly with a heart condition. I get a call from the doctor saying, "Uh-oh, we need more information. We got to life flight him down to a children's hospital." I just am 3 days post a cesarean section, my second in 15 months. I nearly put myself back in the hospital. I'm a mess with my hormones and my tears. I'm going, who's going to take care of my 15-month-old at home? And I'm going, having to make who my doctor is, what I'm going to do, and all they can tell me is we don't know until we get in there. And then they get in there, it's 12 hours of open heart surgery, and I'm going, I'm supposed to pick a doctor. I'm supposed to know all the risks.
Right.
It's a horrible time. These doctors, like yourself, have huge control over us, the patient, and the patient's family at that time, and it's something that should be regarded, and we should be given, even in a state of trauma, all the information.
That's right.
So that I can do my best. And when I come out on the backside of this, I have to see my 5-day-old baby being wheeled into the ICU, swollen to the point of non-recognition. I had to stare at his heart in his chest for 2 days in the ICU, sobbing and crying and hoping I could trust all the medical professionals around me. And the fact that our government's coming in and manipulating the situation and manipulating with fear, eroding trust in that institution is dangerous for our world.
Well, all times that you get into First Amendment issues, that you're going to have, you've got a dangerous situation.
Right, so you have the freedom of speech issues, but you also have, from the medical perspective, the Hippocratic Oath.
Yes.
Now, there's a lot of people who talk about do no harm. That's not in the Hippocratic Oath. But what is in the Hippocratic Oath is who we make that oath to. We make that oath to the people who trained us. So Denton Cooley and Michael DeBakey and the people that trained me, I took an oath to them to not allow my oath to be manipulated by the federal government or federal agencies or anything else, and to my patient. My patient.
And that patient was a 5-day-old baby who has no voice, so then it goes, it defers to me as the mother, not to the government, not to Joe Biden, not to Clay Jenkins, to me.
Absolutely. There's nothing in the Hippocratic Oath that says that I have taken a commitment to the President of the United States, to NIAID,
Fauci,
to NIH, to the CDC, to Health and Human Services, or to the courts.
Or to another mom who says that because you don't get vaccinated, you're going to clog the hospitals. No, I don't owe that mom anything either when I'm advocating for the health of my child.
That's right.
Yeah, it's not your obligation.
No.
That's not something that should be put on you or anybody else. You should not have to wonder whether your doctor is doing the right thing. And we had this conversation before. This is not a health issue, a health freedom issue. I'm a physician. We take an oath to those who trained us and our patients, not to the federal government. So doctors, I hate this phrase, but man up. Okay, just man up, because, or woman up, or whatever you need to call it these days. Okay, the reality is our oath is to our patient. So if the penalty for taking care of our patient is to lose a medical license, then you've maintained your oath and you're still a doctor. But we don't have the option of saying, I'm sorry, we can't treat you the way that we think you should be treated because they'll take my license. So if you die, that's not on me, that's on the federal government. That's not in the oath. We don't have that dump approach, okay? So the reality is, and get this right, doctors, just get it right. This is to your patients. Quit complaining about somebody and coming after you for your license. Do your job, stay with your oath, be a real physician. This is about the people. This is about the people's freedoms. This is about our children and our grandchildren. Nothing more, nothing less. And I don't ever want to miss an opportunity for doing this. So Dr. Fauci, anytime, any place, anywhere, you want to have a debate about this with the general public to give real information and quit with the fear-mongering and misrepresentation of things. I'm here. I live in Dallas, Texas. come visit any place, anywhere, anytime.
Now, Maria, that sounds like a we the people kind of conversation.
I tell you, it sure is. And as a Canadian with dual citizenship, I've seen a travesty happen in my home country.
Yeah.
And being now a dual citizen, I feel so blessed to have met people such as yourself, Lauren, and Dr. Fleming, who have shown me as a representative of we the people that I have an incredible power to come together with other like-minded citizens, other like-minded patriots to say, hey, my voice matters. If I lose bodily sovereignty, it's downhill from there. If we lose bodily sovereignty, if we lose sight of the Constitution, and you've done such a fantastic job to just remind me about nullification. And
great, I love hearing it. That's why I love to share it with people.
I tell you, I'll say it again,
nullification.
As citizens, we have the right to raise our voice, to remind those people in power that you work for us. We don't work for you. And I'm so excited to have this opportunity to come together and say to other citizens, other people that are concerned, that see the travesty, that are watching as we see truckers. Who would have ever thought that the actions that we've seen in Canada towards freedom, the fight for freedom, would have come from truckers? It wouldn't have been me.
Well, it's there to confound the wise, isn't it?
Right? It sure is. Amen to that. I love hearing that.
I say it's a truth wave. They're not coming across for any political party, you know. They're not. They're coming because they seek truth. They seek freedom. They want to reestablish our American foundation that's been completely eroded in every institution now, to our medical community, which is very dangerous because it's a direct impact to our health and our life. And we've seen people die in the hospital. I've had my nephew die in the hospital with a lack of early treatment on remdesivir and then event. And he had the same comorbidities that my mother had trying to get through COVID. She got COVID and the flu. She has extreme COPD. My nephew was overweight and Down syndrome. So they both had very severe comorbidities. One died. One lived. My mother got access to monoclonal antibodies. I had an IV company go to her house, give her high doses, IV infusion of vitamin D, quercetin, and all the things, and just good old fluids, right? Because you can get dehydrated, and that causes a lot of problems. She came out in 3 days a champ. Right? That's not okay, and some people still don't know about treatment. Treatment.
It is, and all of those pieces, and no one can say that you don't know hands-on, first-hand, all of the things that we all have been told are our greatest risks. You've seen them, you've faced them, and here you stand. Now, we're going to take a break, and when we come back, we're going to get into this a little more detailed, and I'm just very excited to have you all here at this table when we come back.
Business runs on technology, and human beings are creatures of habit. Unfortunately, not all our habits are good. Technology, when it works, is supposed to make our lives easier, creating routines that allow us to protect customer data, track our progress, forecast the future, communicate better, and move much faster. So, you need technology solutions that work when you're not working, or simply not paying attention. Smart technology solutions, making the complicated uncomplicated. Interested in starting a podcast or TV show? Worried about what you'll say and how to keep it engaging? Think you'd like to be a guest on podcast, radio, or TV shows? Hi, I'm Susan Hamilton, owner and founder of OBBM Network, and I would like to invite you to an OBBM media training to get the tools you need for a relaxed and polished performance you'll be proud to share. Our specialized training techniques include role play, voice training, and everything you need to deliver a confident, clear, and engaging interaction. Go to offbeatbusiness.com. Go to the calendar and register for a training that's convenient for you. Dates available now, 214-714-0495.
And we're back. This is pretty exciting. Yeah, there's even more. Maria, you are doing some really interesting work to help us understand how you're pulling all these pieces together so that we the people have an opportunity to stand for truth and right.
Thank you. As a Canadian citizen, I was never aware of my power as an individual citizen to the same degree that I am now, living in the States now for nearly 22 years. actually it's been longer than that, how time flies. But anyhow, the point being that I saw with information from Dr. Fleming, when I see the race that you've just won successfully, I think, okay, we can take this information to the people because people are listening. But many people like me may look at themselves and go, well, what can I do? How do I get my voice joined with other like-minded people who may be intimidated, who may be afraid to come out from the shadows and say, no, I think that way too. This Constitution is for me as a citizen. And so it's so exciting to be armed with such valuable information when you know in your gut something is not right, when they are trying to enforce and lock down and harm the economy and harm small business workers to the detriment of us all. This is not right. I've seen it firsthand in my own country. I've come here, and I think it was a God thing that I was connected with Dr. Fleming, that I met you through my friend Aubrey to see the fight that you were taking to the people, and I thought, I want to be a part of that. So a lot of this is information. A lot of it is very difficult, high-level information that's hard to absorb. We don't have to have the degrees and the certifications that our doctor has here, but we can benefit from them. And so I feel like I'm being called to synthesize this information, to get the surrounding opinions and experience of people such as yourself and raise up an army of Dr. Fleming calls them Valkyries.
Yeah, that's interesting, the Valkyries, because it's not red and blue, and I know that that's how it's been defined for us. It's been
not it's nonpartisan.
None of this has anything to do with a party. It has to do with, do you love your nation, and are you willing to work together? And I think you're going to be seeing that as a conservative on Dallas County and a minority. That'll be really interesting, and we're going to make sure you have all the support that you need, aren't we?
That's right.
So tell us about the Valkyrie Initiative.
Well, the Valkyrie Initiative is exciting because the Valkyries historically were women in Nordic mythology that came and directed the souls. You might, as a Nordic Viking, as our Viking representative here, you could speak to that perhaps quite effectively. But and I love Freya, the goddess, who had the power to influence future events. And I think that's what resonates with me, the Valkyries being like a foot soldier. And so I thought, we have the power, our voices, our opinions matter. And if we come together as like-minded women, we have the power to direct future events. So I want to be heard. My husband will be the first one to tell you, my wife likes to talk and she likes to be heard, and I like to focus on the things that matter. I don't want the fluff. I'm also a business owner, so I resonate with your background as well, Lauren, in business, and also we've had medical issues in our family that, my mom, having been mandated to get the shots back in Canada, developed clotting issues, so she's forever now on blood thinners. So that was not acceptable to me. And I wanted to bring the truth to the people. So I've been connected with the channel that can help bring me the truth, the facts medically, and I will put it out there and make it easy for other people to also put it out there. So we are making a list of people that want to be on Team Valkyrie and have their voices count. We want to minimize your efforts so we can maximize our message. So this is all packaged. I have a marketing background. We've packaged it in such a way to make it as easy as possible. Make a phone call, send an email. We're going to make this super easy but highly impactful.
And all that information will be accompanying this podcast and the television and the video format.
Thank you.
The Founding Fathers knew that the battle that they were embarking upon was not going to be easy. They knew they would suffer consequences. They pledged to each other their life, their liberty, their sacred honor, and they took that very seriously. To a person, the government of England came after them. You should expect that if you're fighting for something that somebody else has power of and you're trying to get your power back, there's going to be resistance. But the Founding Fathers depended upon then the people, we the people, to come up behind them. The Valkyries are the group that you're spearheading, in charge of, to help us get the information out, to get the indictments on these people.
Yes.
Not fluff indictments, not reality TV indictments, real grand juries that can
Legal.
hold these people criminally accountable for violating treaty laws, for violating their oaths that they took into office. Because the reality is, treaties provide not only for informed consent, but they prevent these biological weapons from being developed. That's part of what we're going to talk about at the Crimes Against Humanity tour that'll begin in Fort Myers on the 23rd of April, and we'll be here in the Dallas area on the 11th of June to talk about, to make people aware of, to bring the information forward, to get the indictments with real grand juries to hold these criminals accountable in federal court. They can be done in state court, county courts, but it also is dependent upon the people taking action, because by myself, I can't do this. I can do as much as, I can keep talking until I'm as blue as my jacket, but it will not change reality if there's not people behind me. So the Valkyries, Lauren, what you're doing as far as the role that you're willing to take on to represent the people in the county here in Dallas is critical, representing the people in Dallas. People need to be doing this all over the United States, because it comes from the people to the local, to the states, to the federal. And you're demonstrating that at this level. You're demonstrating it by getting the ladies focused on doing this for the indictments and the crimes against humanity, by contacting the attorney generals, and you're doing it by having a television program making people aware of things to help them become better informed to remove the fear issues.
I think it's important to go through that business community. We met before any of this.
We sure did.
For a Christmas event, and it's just so important that the local business understands the power that they have as 90% of American micro to small business.
That's right.
And then the other side of that is, do you know that when you don't participate, the danger that the community's in? Because we clearly, if we think about how this all went down, our response was okay and not prove it. Right. Our response demanded no accountability, and we are the first line of defense between federal, state, and local government overreach and a community that has no idea they're in danger. And when we stand firm, we can move the people that need to be in office to make sure that we don't go through this again.
That's right.
Yeah, I think that's what my race represented, if nothing else. It was an everyday American had gotten tired of it and took a stand. And I know it was a really big stand, right? Doing Dallas County Judge, I got some criticism. Who are you? You've never been in politics. And I was like, I'll wear that with a badge of honor.
That's right.
I really will, because, we need a fresh perspective. We need someone to come and look at this and ask for second opinions. And on all this medical expert advice we're getting, I think where we've gone completely wrong and what has to be restored is we've lost our freedom of speech. It's there in writing only. We have lost it. And now people like Elon Musk going in and using his dollars to buy back, buy some of Twitter, a huge portion of Twitter.
It's an interesting conversation, isn't it?
That's exciting because we cannot lose our free speech, but free speech does not come without consequence. And our founding fathers knew that, to your point, and to your point, and to mine. I lost all my friends, but I just want to encourage people that it's worth it. It's worth everything you're going to lose, because you will. Let's not sugarcoat this and make this fun and this is going to be a social club. When you take a stand, you are entering the battlefield. You will get hit. And it's going to hurt.
But what's the worst risk, right? The greater risk is losing the United States of America and everything it represents.
Churchill said, "You have enemies, good. It means you stood for something."
That's right. That's
and
right.
And as far as I'm not sure why this always comes to mind. When people are uncertain about whether they should speak up or something like that. Most people have been junior high and high school students at some point in time, and they've gone to a boy-girl dance. And the guys are over there sitting, should we? Well, we can't really go ask. Well, what's the worst thing that can happen is being told no. And the best thing that can happen is you dance with the girl that you wanted to dance with, right? The worst thing that can happen to you is that people can attack you. They can abandon you. They can avoid interacting with you. the best thing that can happen is that you can stand up for your rights as an individual, the rights of the people that you care about, your children and your grandchildren.
That's right.
Yes.
And anybody in sales will tell you too that when you hear the word no, that's when the selling really needs to start.
Yes, all great entrepreneurs heard many no's. I've heard
right.
no's. You cannot be afraid of the no.
That's right.
That extends into the political realm. We seem to have these business principles separated from our public service, and I think that day needs to end. We need to be innovative. We need to be accepting of the no. We've got to know that this is going to be a disruptor, but at the end, we are fighting for everybody. I'm fighting for all the parents, at Dealey Montessori, who in writing sent to our board of trustees that my family and my kids were attempted murderers and terrorists.
Right.
There are people who believe that, and I'm still fighting for those people.
Right.
Because they have a right to say that.
think that.
They have a right to their opinion. They don't have a right to their own facts, right?
I'm going to wrap it up here because this is just so exciting, and we're going to come back. We're going to come back with a second episode, so hang on. There's even more. Thank you so much for joining us today, and thank you so much for Lauren and Dr. Richard Fleming and Maria Leon. Thank you so much. We'll be back. You'll find all the links to the information that was shared today in the description box below.